Today we're continue our conversations with the administration on legislation that puts families first. We're very proud of the work that the Congress did last week with an $8.3 billion legislation to meet the needs of social and health services organizations, state and local government, testing, all the rest of that. Testing, so very, very important so that we can have an idea of the size of the challenge, but also that we, first and foremost, that we can meet the needs of those who test positive. Today we'll bring to the floor our Families First legislation, which is what we talked about as soon as we finished the appropriations bill. Listening to our constituents, listening to healthcare professionals, listening to governors, mayors, etc., put the Families First legislation together. It has free coronavirus testing, by and large, for almost everyone in the country. We're having some discussion about that with the administration of maybe some people they want to pay, but by and large, free corona testing so that everyone will be tested and no one will say, I can't afford it, so I can't. And that's not a good idea when it comes to public health. Paid emergency leave with 14 paid sick days, very essential as we deal with this challenge, that public health challenge that we have. Enhanced unemployment insurance, the first step that will extend protections to furloughed workers. Strengthened food security initiatives, very important. Many kids just get their food security from being in school. If schools are closed, we have to make sure that the food gets to the children. It's not, this food is already paid for and appropriated for. It's just a question of getting the food to the children, and that has some cost to it. We also have to get, that's a school lunch program, et cetera, but in terms of SNAP and food assistance for seniors, people with disabilities, helping the nonprofits who are on the forefront of helping people have access to food at this difficult time. And then clear protections for our frontline workers who are working in infectious environments or possible infectious environments so that the OSHA regulations are a protection for them, and then increased funding for Medicaid, the FMAP, that's the initiative that gives money to the states for Medicaid that is used hopefully through the counties and the rest, which deal with many of these health issues to as we go forward. So it's about putting families first. We did the major investment last week. We were very proud of that. Strongly bipartisan, already signed into law, Families First, and there will be other initiatives that we want to work with the administration on that may be necessary as we go forward. Some that need more discussion, more impact in terms of what is the collateral benefit or collateral damage to stopping the spread of the coronavirus. Now, let me just get back to testing. So very important to take inventory, to understand the epidemiological the spread of the virus, and also to meet the needs of the people affected. I'm very pleased also this week that we were able to pass a bipartisan FISA bill in the House. That's a hard thing to do. I know that from my intelligence experience. And that we were able to pass Representative Slotkin's war power resolution, Rep. Lee's legislation to repeal the AUMI is the predicate for how we go forward, and Rep. Khanna's legislation to prohibit funding for military action. So as we go forward, I want to thank the members for the bipartisan legislation that was successful this week on the floor.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.